Hello everyone and welcome back. In this video, we're going to cover the major blood vessels of the heart. It's a quite simple topic, but it's always good to understand based on what we named these vessels, and that will help you to memorize their names and remember them easily later on. So when we talk about the major blood vessels, we are definitely talking about the major arteries and vein. So here we're gonna start with the arteries. So you guys know that the major artery that takes the blood all the way from the heart to all of your body is the aorta. So this is the arch of the aorta. When you look at the aorta, you will find that you have three big vessels coming out of it. And of course, because the aorta is up, that's gonna give the blood supply to everything up. And as it turns back and it goes down as the thoracic aorta, and once it exceeds the diaphragm, it becomes the abdominal aorta. It will take care of everything down. Now, if we're gonna talk about something that's in the up, it means your head and neck and upper limbs, of course. Now, to give blood supply to them, it means I have blood vessels going to the head and neck and upper limbs. So in anatomy, we are descriptive science, so we need to explain what we're seeing. I have arch of aorta and I have only three big vessels coming out of it. Why? Because the arch of aorta is on the left side, so I need a connection that takes the blood to the right side, and there I'm ready to branch off into something that gives blood supply to the head and neck, and then another thing to give to the upper limb. That's why I only have one brachiocephalic trunk, and we call it brachiocephalic because brachium means arm in Latin and cephalic means head in Latin. So the brachiocephalic trunk, I have it only one. It is only on the right because your aorta is in the left. So I want to bridge the gap. And then there only, I will branch off into a brachial branch and a cephalic branch. And these two are going to be the subclavian that will go all the way to the upper limb, and then the common carotid, which is going to the cephalic region. But why do we call it common carotid? Because carotid means deep sleep in Latin. In the very, very old days, they used to think that, anatomists used to think that if you try to press over the common carotid artery, the patient is going to go into a deep sleep and is going to lose consciousness. But later on, they found out that there are other arteries coming to the brain, and that is not true. But by the time they discovered that, they already gave the name. So that's why we call this as brachiocephalic trunk, and this is going to bifurcate into common carotid that goes to the cephalic region and the subclavian that runs below the clavicle. So that's what we mean by sub below clavicle clavian. So the arch of aorta gives you the brachiocephalic that on the right side and left common carotid and left subclavian. The brachiocephalic trunk, it's only one, on the right side, will bifurcate back into right common carotid for the head and neck, and then right subclavian into the upper limbs. Now, if you look at the subclavian, once you go away from the border of the first rib, your subclavian is going to be called axillary. So the axillary artery is what comes out after the subclavian artery. So you have the arch of aorta. On the right side, brachiocephalic trunk. Brachiocephalic gives you common carotid. Common carotid goes to the head and neck. Common because it gives internal and external. Internal to the cranial cavity goes inside. External because it gives blood supply to the external head and neck region. And then the other branch of the brachiocephalic trunk will be the subclavian. And as we get to the axillary region, we're going to call it the axillary. And after that, once we exceed the outer border of the teres major muscle, it's going to be called brachial artery. Now, this is the brachiocephalic trunk. This is your common carotid. This is the subclavian. On the left side, we have only common carotid and subclavian without brachiocephalic trunk. Now, when the arch of aorta comes to the thoracic region, it turns back and it goes down all the way. Once we exceed the thoracic region and we come to the abdomen, this is your diaphragm, it becomes abdominal aorta. And at the level of L4, it bifurcates into right and left common iliac arteries. Why do we call them iliacs? Because this is your iliac region, it's your hip region. So here I have common. Why do we call them common? Because they will further bifurcate into internal and external. The internal will go to the pelvis and give blood supply to your pelvis. So this is what we call internal iliac. And the external goes externally to the thigh region. And once it exceeds the inguinal ligament, we will call it femoral. So the aorta gives two common iliacs. This is a real cadaver, two common iliacs. And then one goes inside of the pelvis, which is the internal iliac. The other one goes externally, which is external iliac. And as it proceeds away from the inguinal, it's going to be femoral because femur means your thigh, and this is your femoral artery at that point. And you will know that the further branches of each one of them in their respective module. Now, moving on to talk about the veins. The names of the veins are quite different. We have right and left brachiocephalic in this case because veins, they are bringing blood from head and neck and upper limbs. So cephalic region and brachial region. So from the cephalic, it's the internal jugular vein, and from the upper limb region, it's your subclavian. All right, it's your brachium. All right, so the subclavian, union of subclavian and internal jugular gives you the brachiocephalic vein. I have right and left vein, and the left vein is longer. Why? Because your right atrium is on the right side, so I need to bridge the gap. So it's the same story. Why we have a brachiocephalic trunk on the right side? Because the arch of aorta was on the left, and I wanted to bridge the gap. In this case, I want to bridge the gap. So here I have my brachiocephalic vein, the left one, runs horizontally to reach to the right side, and it unites with the right one to form the superior vena cava. And once we have the superior vena cava, they drain into the right atrium. So we have internal jugular, subclavian gives left brachiocephalic, internal jugular with right subclavian, they give right brachiocephalic, right and left brachiocephalic veins give you the superior vena cava, and they drain into the right atrium. And from the lower limbs, we have inferior vena cava, it also drains into the right atrium. Now, if you look at this picture, that will show you here the same concept that, because I said the whole concept previously. So the brachiocephalics will give you the superior vena cava, and this is a nice picture to show you that what is superficially is the vein. If you guys look at the vein, it looks collapsed because it does not have muscular wall. It's collapsed without blood. This is a characteristic of the vein. Veins are usually superficial. So if you want to try to identify, once you see it on top of everything, this is basically your veins. If I have a horizontally running or obliquely running vein, this is going to be the left brachiocephalic because it wants to reach the right side to unite with the right brachiocephalic. Together they will form the superior vena cava and open into the right atrium. Here is my right atrium, but this is an open heart and we removed already the heart here. So left and right brachiocephalic, they will form the superior vena cava. For the brachiocephalic, it's formed by common carotid and subclavian. The internal jugular vein. This is veins. When we talk about the artery, yes, it's common carotid and subclavian. But we don't have the arteries here. Here, the arteries are at the back. So I can see the arch of aorta. I can see the brachiocephalic trunk, which is only one on the right side. And I can see how it bifurcates into common carotid and subclavian artery. And on the left side, I can see here the left common carotid and subclavian is at the back. These are the three major arteries of the aorta, and these are the major veins coming into the right atrium. And this is the same story. I have left and right brachiocephalic veins. Together they will form superior vena cava. and they are formed by union of internal jugular vein and subclavian vein. Moving on, the veins follow the arteries. The brachial vein will end up forming axillary, and as you proceed to come down to the clavicle, it's basically your subclavian, and then the subclavian will unite with the internal jugular to form the brachiocephalic. So in this case, you have left brachiocephalic vein, right brachiocephalic vein, together they unite to form the superior vena cava. And this is your axillary, and this is the subclavian vein. So they are basically following the arteries. Thanks for watching. Don't forget to like and subscribe. Thank you.